Ramesh Daggubati. I'm the chair of SCAI, which is the Society of Coronary Angiography and Interventions from United States of America. I'm the Interim Chief of Cardiology at West Virginia University. I'm here today at the CSI NIC meet in Hyderabad 2023. I wanted to talk about the transcatheter aortic valve replacement and aortic stenosis. The transcatheter aortic valve replacement has emerged as a leading mode of therapy for aortic stenosis patients. Patients with aortic stenosis can present with the shortness of breath, chest pain, dizziness, loss of consciousness, or leg swelling. Such symptomatic patients, if they're not deemed to be good candidates, or even if they are good candidates for surgery, transcatheter aortic valve replacement can be offered. In India, about 250 transcatheter aortic valve replacements are being done in a month. However, many people who could be offered this therapy are not currently receiving it. We advise that patients, as soon as they develop some symptoms with shortness of breath and have aortic stenosis, be evaluated quickly by a cardiologist or a cardiac surgeon and see if this is a feasible option for you. There is a severe disruption in the growth of aortic stenosis that we could cause by treating this disease much more earlier. We can save a lot of lives by performing transcatheter aortic valve replacements in aortic stenosis patients. So please seek a consultation with a doctor when you have these symptoms and be diagnosed whether you have aortic valve disease or not, and ask them whether transcatheter aortic valve replacement is an option for you. Thank you.